Mr. Jones is 19-year-old male who has never seen a dental hygienist before, always had cleanings by the DDS. Explain to your patient the process of periodontal probing. Johnny, periodontal probing is a simple and important procedure that helps us assess the health of your gums and the tissues around your teeth. I'll use small, gentle tool called periodontal probe to measure the depth of the space between your teeth and the gums, which we call pockets. Healthy pockets usually measure between 1 to 3 millimeters. If the pockets are deeper, it might indicate inflammation or infection, which could be a sign of gum disease. Probing is quick and usually does not cause any discomfort. But if you feel any sensitivity, just let me know. This process helps us catch any issues early and keep our gums healthy. Susie Jones is an 8-year-old girl who is here for 6-month Profi Recare. Her mother is in the waiting room. The plaque index is 100 with moderate gingivitis. What oral instructions are you going to give Susie? Susie, it is important to keep your teeth clean so your smile stays healthy. I notice there's a lot of sticky stuff called plaque in your teeth. This can make your gums red and puffy, which is not good. To fix this, I want you to brush your teeth twice a day, once in the morning and once before bed. Make sure you brush for 2 minutes each time. We can even use a timer to help. Use small, gentle circles to clean all the surfaces of the teeth, especially near the gums. Don't forget to brush your tongue too. I also want you to start flossing every day. Flossing is like a special tool that helps us clean between our teeth where your brush cannot reach. If you need help with flossing, you can ask your mom or dad to show you how. We'll work together to make your teeth and gums super healthy again. After saying this to Susie, you can also invite her mother to reinforce the importance of daily brushing and flossing and to ensure Susie gets the support she needs at home. Mr. Brown refuses X-ray every time he comes in for an appointment. His last FMX was 7 years ago and bite wing was over 3 years ago. He has periodontitis but is low caries risk. Explain to Mr. Brown why he needs check-up X-rays. Mr. Brown, I understand your concern about X-rays, but they are an important part of keeping your teeth and your gums healthy. Even though you don't have high risk for cavities, you do have periodontitis, which is a serious gum condition that can cause bone loss around your teeth. X-ray helps us see what's happening beneath your gums, like bone levels and the extent of bone loss. Your last full set of X-rays was 7 years ago. And the smaller check-up X-rays we took 3 years ago only showed limited area. With periodontitis, we need to monitor how your bone is holding up to prevent tooth loss and other complications. These X-rays will allow us to catch any changes early and adjust your treatment to keep your mouth healthy. We'll use the lowest radiation dose possible, and the benefits of catching the problems early outweighs the risk. Let's work together to make sure that your oral health stays on track. Okay, Mr. Brown? Miss Jones is 25 years old female who does not want to have fluoride. Discuss the pros and cons of fluoride use. When discussing the pros and cons of fluoride use with Miss Jones, 25-year-old female who is hesitant for fluoride, you can explain. Miss Jones, I understand your concern about fluoride, so let's get over the pros and cons to help you make an informed decision. So, pros of fluoride use. This is to prevent tooth decay. Fluoride is highly effective in preventing caries by strengthening the enamel. Enamel is the outer layer of the teeth, making it more resistant to acid attacks from bacteria and sugars. Fluoride also remineralizes teeth. It helps repair of early signs of tooth decay. It is cost effective. Using fluoride can save money in the long run by reducing the need for more extensive dental treatments like fillings and crowns and root canals. It is widely supported by research. Fluoride benefits are supported by decades of research and is recommended by major health organizations such as American Dental Association and World Health Organization. The cons of fluoride: overexposure risk. In rare cases, overexposure of fluoride can lead to dental fluorosis, which usually occurs in children and result in mild discoloration of teeth. However, this is not a risk for adults with controlled fluoride use. Next con would be personal preference and concern. Some people prefer to avoid fluoride due to concerns about potential health effects, even though these concerns are generally not supported by scientific evidence. Also, another cons is if you have is it an alternative option. If you prefer to avoid fluoride, there are other preventive measures you can take, such as using fluoride-free toothpaste and focusing on excellent oral hygiene and diet. If you have any specific concerns, I'd be happy to address them. My goal is to help you maintain your oral health in a way that you are comfortable with. Mr. Jones is a 42-year-old male who recently been smoking for 2 years, 2 packs a day. Discuss possible periodontal complications due to these risk factors. Mr. Jones, smoking is a significant risk factor for your oral health, especially when it comes to your gums and your tissue supporting your teeth. Let me explain some potential complications. Increased risk gum disease. Smoking reduces blood flow to your gums, which means that you don't get the oxygen and the nutrients that need to stay healthy. This makes it easier for bacteria to cause infection and increase your risk of developing gum disease or periodontitis. Next would be slower healing. If you develop gum disease or need any dental procedures, smoking slows down the healing process. Also, bone loss. Over time, smoking can lead to more severe bone loss around the teeth. This bone supports your teeth, and losing it can cause teeth to become loose or even fall out. Reduce treatment effectiveness. Smoking can also make treatments for gum disease less effective. For example, procedures like deep cleanings and surgeries may not work as well because your body's healing response is compromised. Next is masking of symptoms. Smoking can mask early signs of gum disease like bleeding gums, making it harder to catch condition before it becomes serious. Quitting smoking or even reducing the amount of smoke can greatly benefit your oral health and reduce the risk. When we can discuss more strategies to help you if you're interested. Taking steps now can help protect your teeth and your gums in the long run. Miss Jones is a 30-year-old female who presents with herpes on her upper lip. Explain what you need to do and why. Miss Jones, I see that you have a cold on your upper lip, which is caused by herpes simplex virus. Cold sores are contagious and the virus can easily spread through contact. Because of this, we'll need to postpone any non-emergency dental treatments today. This is to protect both you and others from the risk of spreading the virus. Performing dental procedures could irritate the sore, causing it to worsen or take longer to heal. In the meantime, I recommend avoiding touching the sore, Make sure to wash your hands frequently and apply an over-the-counter antiviral cream to help it heal faster. Once the sore has fully healed, we can safely proceed with your dental treatment. If you have any questions or need advice on managing the cold sore, feel free to ask. We're here to help you through this and make sure that you are comfortable. Mrs. Brown is 58 years old, female whose assessments show evidence of moderate horizontal bone loss on the X-ray, 3 to 7 millimeter pockets, and generalized bleeding on probing. Explain the periodontal disease and what treatment needs to happen. Mrs. Brown, based on your assessment, it appears that you have periodontal disease, also known as gum disease. This is a chronic infection that affects the gums and the bone of the bone supporting your teeth. Here's what's happening. There is bone loss. The X-ray shows that there has been some bone loss around the teeth. This is concerning because bone is what holds your teeth in place. Without proper treatment, this can progress, leading to loose teeth or even tooth loss. Pockets between your teeth and your gums are deeper than they should be. Healthy pockets are usually between 1 to 3 millimeters, but yours range from 3 to 7 millimeters. Deeper pockets can trap more bacteria, which worsen the infection. And also there is bleeding. The bleeding that you're experiencing during probing is a sign of inflammation and infection in your gums, which is a common symptom of periodontal disease. Now with treatment, scaling and root planing or deep cleaning, this is the first step in treating your periodontal disease. We'll clean deep below the gum line and remove plaque and tartar buildup that's causing the infection. We'll also smooth the root surface to help your gums reattach to your teeth. Also, we'll have antibiotic therapy. In some cases, we just use antibiotic to help control the infection and reduce the bacteria in your mouth. You will be having follow-up visits. After deep cleaning, it is important that you have regular follow-up visits to monitor the progress and make sure that the disease is under control. We might also need to do additional cleanings to keep the pockets from deepening. Also, good oral hygiene. At home, maintaining excellent good oral hygiene is crucial. This includes brushing twice a day, flossing daily, probably using an antimicrobial mouth rinse to help the bacterial levels low. By addressing this now, we can help prevent further damage and protect your oral health. Let's work together to manage this condition and keep your teeth and gums healthy as possible. Mr. Jones is 50-year-old male patient who takes multiple medications and complains of ceremostomia but no sensitivity. He does show some incipient caries. In addition to oral hygiene instructions, what recommendations will you make to Mr. Jones? When advising Mr. Jones, 50-year-old male with ceremostomia or dry mouth and some incipient caries, and in additional oral hygiene instructions, you might say, in addition to oral hygiene instructions, you might say, Mr. Jones, since you're experiencing dry mouth, which can be a side effect of your medication, you have some early signs of tooth decay. There are few recommendations I'd like to make in addition to maintaining good oral health. So first, you have to stay hydrated. Drink plenty of water throughout the day to help keep your mouth moist. Sipping water frequently can help counteract the dryness. Also use saliva substitutes. There are over-the-counter saliva substitutes or oral moisturizers that you can that can help alleviate your dry mouth. These can come in sprays, gels, lozenges, and they can help keep your mouth more comfortable. Next would be chewing sugar-free gum, especially those containing xylitol, can help stimulate saliva flow, which is beneficial in reducing dryness and preventing cavities. Avoid caffeine and alcohol. Both caffeine and alcohol can dry out your mouth further, so try to limit or avoid these. Also, consider using fluoride toothpaste and possibly fluoride mouth rinse. This will help strengthen your teeth and protect against decay, which is important given your increased risk due to dry mouth. You must limit sugar and acidic foods. These can increase the risk of tooth decay, especially when saliva is reduced. Try to avoid snacking on sugary and acidic food drinks. And also, have a regular dental checkup. Since you have early signs of decay, it is important to keep up with regular dental visits so that we can monitor your oral health and address any issues early. By following these recommendations, we can help manage your dry mouth and reduce the risk of further tooth decay. Let me know if you have any questions or if there's anything else I can help you with. Mr. Brown, male, 28 years old, who takes medicine for anxiety and depression and has indicated he is very nervous about the prophy appointment today. What can you do? Or say to Mr. Brown to reassure him? Mr. Brown, I completely understand that dental visits can be stressful, especially when you're feeling anxious. It is important to me that you feel comfortable as possible today. Here's what we can do to help you relax. If at any point during the appointment you feel uncomfortable or you need a break, just let me know. We can take things at your pace and you are in control. I will explain what I'm going to do before I do it, so there are no surprises. Sometimes knowing what to expect can help ease the anxiety. We can try some deep breathing exercises or other relaxation techniques if you like. Taking slow, deep breaths can really help calm the nerves. If you find it helpful, you can listen to your favorite music or podcast during the procedure. Some patients find this helps make their mind off things. I'll do my best to make sure you are comfortable as possible in the chair. If there's anything specific that helps you relax, please let me know. Remember, you're not alone in feeling this way, and we're here to support you. Let's work together to make this visit as easy and stress-free as possible. Next, Mrs. Reed has brought her 6-year-old daughter Chloe for checkup. The doctor has recommended sealants on some of her back teeth and fluoride treatment. Mrs. Reed is okay with sealants but is skeptical about the benefits of fluoride treatment. Explain the fluoride treatment benefits to Mrs. Reed. Mrs. Reed, I understand your concern about fluoride, so let me explain how it works and why it is beneficial for Chloe. Fluoride treatment involves applying fluoride gel or varnish to Chloe's teeth. It is a quick, simple procedure that we typically do at the end of the dental visit. The fluoride helps to strengthen the enamel on her teeth. The benefits of fluoride is that fluoride helps to remineralize and strengthen the tooth enamel, making it more resistant to tooth decay. This is especially important for children like Chloe who are at high risk for cavities. By strengthening the enamel or the outer covering of the teeth, fluoride helps to prevent new cavities from forming and can help to stop small areas of decay from getting worse. Next, it is safe and effective. Fluoride treatments are safe and have been used for decades to help protect the children's teeth. The amount used is carefully controlled to ensure it's effective but not excessive. While sealants provide preventive coating on the chewing surface of the back teeth, fluoride helps protect all the surfaces of the teeth from decay, offering an additional layer of protection. It is cost-effective. Investing in fluoride treatment now can help reduce the risk of cavities and more extensive dental work in the future, which can be more costly and invasive. If you have any specific concerns about fluoride, or if you'd like more information, I'm here to answer any questions you might have. The goal is to provide Chloe with the best possible care to keep her teeth healthy and strong.